Are your poops normal? Do you know what constitutes a normal poop? Well, to answer this question, we have to talk about what's abnormal. But first, I'm Dr. Brian Tosquejo. I'm a California licensed naturopathic doctor, and I focus on acne and eczema treatment. And you're probably wondering why a skin-focused provider like myself is talking about poops and gut health, right? Well, that's because I see my patients holistically. And what that means is that I see that their skin health is a visual representation of their overall health. And yes, science has linked gut health to skin health. And your poops can provide valuable insights as to what's going on with your gut, but also what could be affecting your skin. Now, to answer this question, like what I said earlier, we have to talk about what's abnormal. And we have to talk about three things: frequency, consistency, and color. So first, with frequency, I'm sure you've heard of constipation and diarrhea. Constipation is defined as having 3 or less bowel movements a week, while diarrhea is defined as having 3 or more bowel movements a day. So given those definitions, the goals are having more than 3 bowel movements a week and having less than 3 bowel movements a day. Now, let's talk about consistency. If you aren't looking at your poops, look at your poops. Because if you do, you can look at the Bristol stool chart. This fun chart categorizes poops as 7 different types, and it also tells you what it means. And as you can see by looking at this chart, the goals are having types 3 and 4. Now, let's talk about color. The goal is having a lovely shade of brown. We don't want a black poop, we don't want a pale poop, and we don't want a poop with red streaks. If somebody's having a black poop, it may be suggestive of an upper gastrointestinal bleed, like in the stomach or in the esophagus. Now, if somebody's having red streaks in their poop, it may be suggestive of a lower gastrointestinal bleed, such as with hemorrhoids, a fissure, or something else going on in the lower gastrointestinal tract. And if somebody's having pale poops, it may be suggestive of issues with the liver or the gallbladder. So if somebody's having any abnormalities with poop frequency, poop consistency, or poop color, it's worthwhile that they speak to their doctor about what's going on. But as a quick recap, we talked about what's normal with pooping by talking about what's abnormal. And today we talked about frequency, consistency, and color. And this might be TMI, but how was your poop today?